Meet our provider, Stephanie Brooks, behavioral health therapist, Cumberland Clinic. What got you started in the healthcare field?
I enjoyed psychology classes, and I found learning human behavior fascinating. And my experience and story also contributed to my decision to pursue therapy.
How would you describe your philosophy of care?
I'm client-centered, meeting clients where they are and identifying their needs. They may not know their needs. That might be why they're in therapy, and just coming alongside them.
What drew you to work at North Lakes?
North Lakes just had a encompassing approach to care for their communities. And so I liked that. I liked the care of mental health, physical, dental, chiropractic, community needs. There's just such a bigger picture than just therapy, than just medical, and so when you can meet those different areas for people, it makes a huge difference.
What does the North Lakes Community Clinic mission mean to you?
North Lakes mission, and there's just an attuned care to people, and it's not just a clinical business, but it's also, there's like a connective side that I would say just has a warmth for people to feel like they can approach North Lakes.
What advice would you give to your patients prior to seeing you?
I recognize it's a courageous step, and it's not taken lightly to pursue therapy. You're presenting very vulnerable parts of you with someone that you don't know. Your first time coming, they'll expect questions and just your paperwork, but that process all has a meaning and a purpose. But we will work on just that connection and alliance, and just know that I'm with you.
What are your professional interests?
I've worked with women with late diagnosis of ADHD and ADD, and have found that to be a very bigger need than I realized. There's a lot of emotional shame and embarrassment and low self-esteem in that, and working with women who just need that kind of structure and support, it's been really helpful. I've also got training with the John and Julie Gottman Institute with couples work, and have helped couples navigate challenges and areas and different seasons of life that are thrown at them. And I've also have training in brain spotting, and that has been a really effective tool to help people with trauma and restructuring and thought processing and facing difficult emotions. Also with kids, I've enjoyed play therapy and sand tree therapy. That's been a fun. And then art was always good, but helping kids find an safe outlet for their emotions and how to process them. Just been really fun to see them grow and develop.
What's your favorite Wisconsin food?
Oh, your cheese curds. Yeah, you got cheese down.
What are some of your hobbies?
Up in Alaska, where I'm from, I thoroughly enjoyed fishing off the ocean. Just salmon, which salmon's hard to find down here. Good salmon. But fishing and but otherwise I love just spending time with my family, being outside on the lake, and soon gardening.
Stephanie is a behavioral health therapist at our Cumberland Clinic.